between Aaron Rodgers and this miraculous comeback that everybody's talking about, potentially sooner than anyone ever thought, which we'll get to in just a moment. And obviously the biggest story in Jacksonville right now is this knee injury for Trevor Lawrence. And if you're just jumping in here on ESPN 690, Trevor practiced in a limited fashion today. Plenty of video out there in the early stages of practice with a brace on the left knee, but going through the individual workouts. Word is that C.J. Beathard got a lot of the first-team reps. Also, Trevor just talked to the media and said he is tracking in a good way, trying to get himself available for Thursday night. But too soon to know exactly if he'll play in some 52 hours from now. And right now we are joined by Dr. J. Turner Vosseller from Jacksonville Orthopedic Institute. And, well, we don't want to talk too specific about Trevor's injury. We could talk about knee sprains in general, if you don't mind, Doc, just a moment. There's got to be different levels of this, just like any other part of the body, right, from mild to major.
Pretty much, yeah. Thanks for having me, Brent. So, yeah, I mean, I don't know the specifics of it, obviously, but the, an MCL injury, which is the big ligament on the inside part of the knee there, is commonly sprained. It's very different than like an ACL. A lot of times, patients are conditioned with an ACL. They think they have to have surgery, which is true specifically for that ligament. But for other ligamentous injuries, that's often not true, and that's the case with an MCL. And like you said, I mean, it's basically you grade it like kind of mild, moderate, severe, and then it really depends on, where people fall along that spectrum. I mean, it's tough that it happened obviously on a short week, so that just kind of decreases the recovery time. But I mean, Trevor's a tough guy. I mean, I certainly wouldn't bet against him, but I guess we'll see what happens.
Yeah, when you're talking about, again, I think this goes for all injuries, but just you're the doc. You can walk us through a little bit of this from a recovery standpoint. I mean, I would guess after day one, you got to see where the swelling is at. Obviously, you're going to get, from MRIs to X-rays and all those other things, but then the real recovery could probably just start taking place on more like a Tuesday or a Wednesday during a normal week, I would think.
Yeah, I mean, there's certainly an effort to try to limit the swelling and, keep things moving well and so forth. And the training staff obviously are all over that. And then, I suspect with something like that, there's kind of like a threshold of stability. So, I mean, if it's a lower grade injury where there's good stability, then it's really going to depend on just pain, how much it hurts. And then, in the fact that they're playing on a turf field and a dome, I mean, may influence things to some degree as well. But yeah, it's really going to depend on kind of two things, really. I mean, just the severity of the injury and then what his recovery looks like over the next couple of days and how much pain he has.
Yeah, you just brought something up that everydy's asking us or saying. It's like, what about the turf? And like, I did just kind of say this to Casey in our break. I was like, well, I think there's this stigma now about turf versus grass, and some of it is certainly scientific proof. But I feel like all of a sudden in the sport of football, there's this stigma like, oh, no, don't walk on a turf field or you're going to get hurt. How much do you think does come into play here that they are on turf rather than grass this week, and also on the short week, of course?
Yeah, I mean, I think it's so it's interesting when you look at injury risk because some of the studies that have looked at grass versus turf are actually funded by the companies that produce the turf,
of course.
Which obviously makes it a little bit difficult to know what to conclude from that. But the NFL actually looks at that stuff pretty closely, and it's not as clear cut as it might be. I mean, I think if you're like me, I mean, obviously I like a grass field and feel like that's how it should be, but in some cities that's more of a challenge. But yeah, the data is kind of not that clear. I think it's weird because there's some stadiums, like specifically in New York. I mean, there's two Jaguars that have had Achilles injuries there, and then obviously that's where Aaron Rodgers had his. And so it may be that the surfaces at certain stadiums are maybe greater risk than others. But yeah, I mean, it's more of obviously the turf now is better than it's been historically, but you worry that people take a little bit more of a pounding, especially with injuries around the joint like an MCL.
Yeah, it's pretty interesting in that regard. I'm going to ask you one more about just the knee in general. When you have a knee sprain, does it put you at risk for other things? And is that something to guard against for any player? In this case, obviously, the Jags quarterback.
Well, 100%. Yeah, I mean, I think, like I said, that's where there's some On like physical exam, you're kind of trying to see how much play there is in that ligament there, and that goes into how they grade it to some degree. So, I mean, if there's obviously more instability, if you will, then that's something you can be much more guarded with, versus one where it's just kind of like sprained, but everything's kind of intact. Just because it can put more strain on like the meniscus or the cartilage pads that are there, or the ACL, or you certainly would be at risk for injuring something else if there's more instability.
Yeah, that makes a lot of sense. Dr. J. Turner Vosseller from Jacksonville Orthopedic Institute with us, Brent and Friends on ESPN 690. Appreciate your insight on all of that. And once again, I'll just say the Jags have to monitor a lot of this and be the smart play, because if he doesn't play Thursday, he would play one football game, assuming he plays in Pittsburgh, in a 28-day window. That has to be part of the equation here for the Jacksonville Jaguars from a smart play standpoint. But then you also got to keep 16 off the field because he wants to play. Speaking of a guy who wants to play and get back, Aaron Rodgers. Doc, this stuff's crazy. Like, what is going on with the Achilles here? And this is something you specialize in on the Achilles front. I mean, you've got to be watching this from a distance saying, what are people talking about? Back by week 15, some of the reports are. Back by week 12, potentially. He's out on the field without, like, crutches, throwing the football. What is going on with this Aaron Rodgers Achilles?
I tell you, man, if he were my patient, I'd be pulling my hair out. I mean, so the concern with that injury. So as a surgeon, what we look at postoperatively is the resting tension. So obviously when you rupture the tendon, that's what's thrown off, because things aren't connected. And so when we put it back together, we want to make sure that it's right where it is supposed to be. And there's a lot of evidence that there's a lot of things that can screw that up, after surgery. And so, for me and for a lot of people, I have people in a boot. They're in a boot with this big lift underneath their heel. It's almost like they're walking on their tiptoes because we're trying to protect that repair. And, he showed up at, I think it was like 2 weeks after his surgery on that Monday night or Sunday night game or something, where he just like walked out there and was barely using crutches and looked like he was in a regular shoe, which, I would just be really concerned that his resting tension would be impaired. And so I don't know I know who did his surgery, but I'm not sure how happy they are with that, or if he's just doing that on his own. But that would certainly impair his ability to kind of get back to 100%. Quicker. And, for a long time, surgeons thought we need to rehab these injuries more aggressively, and that's why, people don't get back soon enough because we don't rehab them aggressively enough. But a lot of us have moved away from that because we realize that's just not true. So anyway, it'll be interesting to see how it plays out, but we'll see what happens, I guess.
Yeah, that's really interesting perspective from you, Dr. Vosseller from JOI, with us here on Brent and Friends on ESPN 690. I just, in my crazy mind, not my medical mind, going on with Aaron Rodgers, he obviously signed a big deal. He wants to be out there. He's 39 years old, Doc. Like, he's probably like, hey, I've got 2 years left to do this thing, and I do play the quarterback position rather than a running back trying to come back from an Achilles. Like, could those be weighing on this expedient recovery, the fact that he plays the QB position, the fact that he really only has to keep this thing together maybe for another 24 months of his career? I'm just wondering if some of those might be factored in rather than a 24-year-old athlete like James Robinson or maybe a DeJuan Smoot that we just saw is just in his prime.
Sure. Well, I'm sure that's some of his motivation, I would imagine. So the deficit that people have, I think we talked about before, is just they're weak.
Yeah.
And that's what takes forever to get back to normal. But there's also, there's probably some risk to some degree of re-rupture or some elongation of the tendon that exists in that 6 months. And there's pretty good evidence that risk is there. And so, the concern, I guess, is that, number one, he may just not have enough strength, even though it's more limited than if he were like a running back or something. He may not have enough strength to, drop properly or push off like with the strength that he would need to really fire a ball downfield or something. And then if he were to, injure it, even if it was in a lesser way, or were to elongate his tendon to some degree, then that would also impair his ability to get his maximal strength back. So if he were my patient, I would say, I understand you want to get back, but like my concern is that like you're going to like screw it up.
Yeah.
and you won't be able to play at all next year. And so, for me, I would just say, if we make the Super Bowl, then, maybe you'll be ready to go. But otherwise, I would look to next year.
Dr. J. Turner Vosseller with us here, Brent Friends on ESPN 690 from JOI. Check out joionline.net. Also, you can see Dr. Vosseller at San Marco if needed, specializes in the foot and ankle area. And one more for you, Doc. DeJuan Smoot played last week, coming off his Achilles injury, and said when we talked to him on Sunday, now who knows how he felt on Monday, but on Sunday said he felt great. He actually played quite a few snaps, like 41% of the snaps. I think way more than any of us from the outside thought he would play. That's got to be a pretty good sign for how his recovery went, right?
Yeah, I think so. I mean, I think it's awesome. It's like I said, that strength deficit just can kind of get you, and I think it. But when it gets back, then it's back. So I think it's the without getting too much into it. I mean, I think that the team has obviously been very patient with him, and it's good to see everybody yelling Smoot again.
Yeah, absolutely. Good stuff. Dr. Vosseller, we appreciate you taking a few minutes. Perfect timing, like we said, but we always learn a thing or two every time you come on from JOI. Hopefully we'll see you again or hear from you again down the road.
Sounds good. Thanks, Brent.